Hello, everyone, and thank you for joining the Scleroderma Foundation Virtual University Patient Education Fall Series. Today's event is titled Gentle Yoga and Yogic Breathing for Scleroderma Symptom Management. My name is Angel Soto, and I'm the Programs and Services Associate for the Scleroderma Foundation National Office. I'm one of many organizers here today, and I'm accompanied by the Director of Programs and Services, Carrie Connolly, and the Director of Chapter Relations, David Murad. Before we get started, I want to share some quick notes on today's event. If you are properly logged into the webinar today, you should be seeing Dr. Sundar Balasubramanian on your screen, and you should hear my voice. If you have dialed into the event by phone, please turn off your computer microphone or turn it off or lower the volume to avoid any sound feedback. If you're using a handheld device, you may be required to swipe right or left on the device to see the full screen. Today's webinar is being recorded and it will be made available after the broadcast. We encourage attendees to use the question and chat feature on the right side of the screen to submit any questions, and our national staff members will be holding a Q&A segment at the end of the presentation. All right, so let's get started. I'm happy to introduce today's speaker, Dr. Sundar Balasubramanian. Dr. Sundar is a cell biology researcher at the University of South Carolina and is the founder and director of Prana Science Institute. Sundar's yoga research has provided scientific evidence of how yoga methods, especially breathing techniques, could promote well-being in health and disease. He's the author of 4 books and many book chapters and provides webinars and workshops on this topic worldwide. Welcome and thank you for joining us today, Dr. Balasubramanian.
Hello, everyone. Thank you, Angel, for the wonderful introduction, and thank you to the Scleroderma Foundation for organizing this. I've been working with the Scleroderma community for the past 4+ years. It's been a great pleasure and to share whatever information that we know through our research and practice. In today's session, I'm thinking to give a very brief introduction and then go over some exercises, gentle movement exercises, and then breathing exercises. And I'll be happy to take any questions related to the practice and then the science behind it. As Angel mentioned, I'm from the Medical University of South Carolina. We are working on how yoga methods could be useful in symptom management in various diseases, and scleroderma is one specific example where the exercises would be important in managing symptoms. We have a clinical trial going on right now in 30 scleroderma patients, where we will be teaching them the exercise. They will be doing the exercises at home and measuring how it improves the quality of life or salivary biomarkers. One important thing that we found in the lab is how exercises like the breathing exercises or relaxation exercises would improve salivation. So salivation is an indicator of how relaxed we are or how less stressed we are. The salivation and the tear formation and internal secretions, these are all some of the kind of outcomes of our relaxation response. We found a lot of biomarkers or molecules that are relevant to disease, stress, and inflammation, and we are studying those in that clinical trial. What happened, as you all know, because of the pandemic, we were not able to bring in participants for the study to our the MUSC clinic area. So what I decided was that made a telehealth kind of intervention. So everything that I provided designed as a way of in-person mode, we transformed that to the telehealth mode, where I was teaching the class from March to July every week on Saturdays, and it was a very well-received session. A lot of people liked it. We try to make that as a kind of the telehealth intervention and to study this. So we are currently working on grant applications to study this in a larger number of people. So definitely there's a lot of interest in yoga. As soon as you think about yoga, people are kind of thinking about the postures, the hard to do postures. But here, what we are going to do is everything is done very gently. You can determine your own comfort level. So I'm basically sitting on a chair. So this is open for all levels. You don't have to have a prior yoga experience. And if you feel that you can do it, if you think that your body is accepting it, you're good to go. So I'm sitting on a chair like here. So just a chair. There's my little puppy. It's in the background. So you can sit on a chair and comfortably. Right? You can use the backrest or the armrest. So the exercises, we'll go over the exercises one by one. Each exercise we'll do maybe for about 3 minutes or so. Okay. So the first one, let's rest our arms and bring your awareness to the whole body. So watch how we sense or how we are aware of our body. As soon as you start bringing little focus on the body, you will be watching the breathing. Take a few deep breaths. Nicely inhaling from bottom to top and exhaling from top to bottom. Okay, you can open your eyes. Let's start with the eye movement exercise. So what we are going to do is we are going to look up, down, without moving the head, just look up, just moving the eyeballs, down, up, and down. Do it a couple of times. Do it very slowly and stretch nicely, looking at the dark edge. This gives a very good exercise to the eye muscles. And close your eyes. Open your eyes and then move left to right. Look into the dark edge. You don't have to do it very fast. Just do it gently. The stretch is the most important thing here. And do it about 3 to 5 times. And close your eyes. Again, open your eyes and then go diagonally. Top right, bottom left. About 3 to 5 times, and then close your eyes. Open your eyes again and go in the opposite direction. Top left, bottom right. And close your eyes. Now open your eyes and then rotate the eyeballs all around. a complete circle, looking at all the dark edges. And go in the opposite direction. Gently close your eyes and rub your palms. Generate some heat. And cover your eyes. Let the nice warmth feeling penetrate through the eyelids into the eyes. And gently bring the tips of your fingertips over the eyelids. And take a nice deep breath, thinking about your eyes. And you can open your eyes. So now let's do the wrist rotation. So just move your wrist, rotate them in a very slow manner, as comfortable as possible. You're the best person to determine how you can do this exercise and how much you can do it. Now try in the opposite direction. Very nice. Whenever we are doing an exercise to that part of the body, our complete mind awareness is in that part of the body. And rest your arms. Nice deep breath. Breathing out into the arms, thinking about the arms. Take a deep breath. Let's do the shoulder rotation. So gently opening up, pushing the shoulder blades back, and then bringing them forward, squeezing them, just like writing an O with the shoulder. You can also connect that with breathing. So as you breathe in, you can open up. And as you breathe out, you can come forward. Very slow and gentle breathing. It helps all the accessory muscles in breathing. It's a good coordination. You can do these as slow as possible, as comfortable as you can. And in the opposite direction. Gently come to rest. Take a nice deep breath. Thinking about the shoulders. Now let's do the ankle rotation. So you may not be able to see my ankle, but just writing an O with my toes. So both toes are going in circle. So when you pull the toe upwards, nicely give a stretch so that the calf muscles are nicely stretched. And in the opposite direction. And rest your legs. You can also use a little pillow to keep a good rest. And you can open your eyes now. Let's do the neck rotation. So make sure that you feel comfortable in all the exercises. If there is any surgery in any part of the body, just to determine and be comfortable. If there is no pain, don't try it too hard. Okay. So for the neck rotation, bring your chin towards the chest and gently tilt the head to one direction. Slowly rotate, experiencing the stretch at every single angle. Speed is not important here. It's like how slow and with awareness that you're doing. And in the opposite direction. See how these gentle stretches stimulate salivation. There may be a little bit more moisture in your eyes too. Come to the center. Take another deep breath, thinking about the neck. Nice. Now let's do the forward bend. It's a very good exercise. Just stretch the arms on the side as much as possible. Gently raise your arms. Stretch a little bit as if you're going to touch the ceiling. And gently move forward. Stretch forward first before bending down, and then slowly bend. Rest your neck, relax your neck, relax your head. Nod yes, nod no. Relax your shoulders. Let the arms be hanging on the side of your legs. If there is any tension in the top part of your body, relax them. Very good, restful pose to the heart. The more you exhale, breathe out, the more you will bend forward. And slowly raise, stretching your arms up. And to the sideways. And then rest the arms. Take a nice deep breath. Open your eyes. Now, let's do the knee to the head to the knee, however you call. So what we are going to do is we are going to use the rest, the chair seat. You can keep that as a resting place for your foot, your knee, and bring it as close as possible. You can even scooch over to the front if you don't want to use the support or support of the seat. So basically, you bring one knee nice and as close as possible to your forehead or nose, wherever it is able to come closer to your head. It's a good massage to the abdominal organs. Your breathing may be very shallow. Bring your awareness to the tummy. And slowly release. Now the other leg. Hug your knees. Relax the other leg. And bring your face, head as close as possible to the knee. You can do many of these poses on the yoga mat also. And slowly release. Now we'll do a little twist. So here also, just to scooch out to the front of the chair and put right leg over the left leg. And then use the back of the chair as a support. And straighten out. Sit up as much as you can and gently turn back. So there's no perfect pose. Whatever you're able to do, that is the perfect pose. So use the little force here on the knee is to twist a little bit more. Every exhalation, you try to extend your spine, straighten up. And every exhalation, try to bend or twist a little further. Inhale, straighten up, exhale, twist. Very micro movements. and slowly release. Watch how nice the spine is now kind of twisted, exercised. Many of these exercises will help with the flow of the cerebrospinal fluid. Now the other leg. Whatever the leg that's on the top, that is the side you will be turning. That's easy to remember. Generating a little opposing force here. We sometimes look at all the yoga poses on the posters, Instagram, and probably we're intimidated. Oh, yoga is not for us. It's not for me. I'm not that flexible. But yoga is for everyone. Anything that we can do to our ability is yoga. See how that stretch is kind of helping our blood circulation factors to be produced and help with our well-being. And slowly release. Every time you do these exercises, like the breathing gets much easier. So that tells us that how good that exercise is in helping us. And now I think, so this is the physical part. There are, of course, so many different exercises we can do, but I want to just move to the the breathing exercises now. Come to the realization or the awareness of the breathing. You can close your eyes if you want, or look at something that doesn't move. At the tip of the nostrils, watch how every inhalation and exhalation go through. So this awareness in the breathing will help us to extend the breathing or realize where we block. We sometimes restrict our breathing to the chest. The moment you start watching the breathing, you will watch where it is blocked. So we'll slowly engage with that area and try to extend the breathing. So as you exhale, exhale from the upper chest, the lower ribs. As you come to the lower ribs, think about the ribs on the sides, and then slowly exhale, tucking the tummy in as much as you can, and slowly breathing. Feel the tummy, feel the lower ribs, the upper chest, all the way up to the collarbones, and slowly releasing. Releasing from top to bottom, and filling from bottom to top. All the breathing is through the nostrils. We breathe about 15 times every minute. That's a lot of breathing, 21,600 times a day. By slowing down on the breathing, we'll improve our stress response, our brain's ability to work on better things rather than coping up with the stress. Our immune functions and functions of the heart, they all can improve with slow breathing. Breathe in fully, breathe out completely. When we do this exercise, try to put the mind with the breathing. You move up and down. Let the mind move up and down with the breathing. We can also engage in an activity or vocalization, little sound you can produce after you inhale completely, exhale as the humming. It's a very nice inhalation and a long humming. One inhalation, one humming. Repeat it. And slowly come to normal breathing. Watch the breathing. Open your eyes. Now we're going to do the alternate nostril breathing exercise. We're going to inhale through one nostril, exhale through the other, and then go on like this. If you have a completely blocked nostril, you won't be able to do this exercise, but rather you can try the same humming or the deep breathing exercise that we started with, right? So in this exercise, the alternate nostril breathing, it is set to balance the two systems, opposing systems within our body. So we're going to close one nostril, slowly breathe in. The same exact breathing pattern. Close that nostril, open the other one, and breathe out. Very slow breathing out. And breathe in. You can keep your fingers in any way that you like. And this arm, you can rest it. I'm just showing it to to the direction of breathing. Continue very slowly with an awareness of how the air moves between those two nostrils, and bring your awareness to any other sensation in your head. Breathing exercises are very good when you try them before your meal, or at least 2 hours after the meal. So you'll have enough space to breathe in and out. You may also notice that one nostril is more open than the other one. Just watch that. When you breathe out of the right nostril, come to normal breathing and watch the breathing. You can open your eyes. Let's do a breath hold exercise now. So this has a little bit of timing. So the inhalation, so you're going to exhale through the left nostril. So you'll close the right nostril, breathe in through the left nostril, nice and swiftly, right? It will be going something like this. Full inhalation, right? So that is for 2 counts. So the 2 counts can be, you can think of something in your head. So chanting, maybe I'm powerful, I'm beautiful, anything you want to say to yourself. You can say that twice. That is the time for inhalation. And once you inhale fully, hold it, hold both nostrils for a count of 8, chant. So the 8 things are the same chanting going on in your head for 8 times. If you cannot hold for 8 times, that's okay. You can hold as long as you can. So then after the breath hold, you open the right nostril and breathe out for a count of 4. So the same chanting, same way of chanting inside your head, and then 2 chanting for inhaling, 8 or anything that is comfortable for holding, and 4 for exhalation. So the 2, 8, and 4. So it's always one way. So in always here, out always here, right? And also the exhalation step is very important, that once you exhale completely, you will be able to make space for inhalation. So the cycle can go on nicely without any interruption. And if you want to take a break, you take a break. If there's one nostril completely blocked, you can do the exercise by breathing in through both nostrils, or the nostril that's open. Breathe in, hold, and breathe out for the same timing without the nostril switch. That is only if your nostril seems to be blocked. Other than that, you can, if both nostrils are kind of open, one may be a little bit more open than the other one, that's okay. It happens with the normal nasal cycle. So breathe in through the left, hold, and breathe out through the right. Okay, let me show one round. That is the beginning of the next round. Okay, let's try that. I'll show the count just for easy following. This is the study exercise that we found there is an improvement in the salivation. The breath holding will help us with better circulation and also good relaxation. You can do this exercise for any time between 5 and 25 minutes. So if you take any exercise regarding the breathing exercise, you can do that for any time from 5 minutes to 25 minutes very easily. You can just take one exercise and follow that for the whole period, or you can take a couple of exercises and try it. And there is no need to follow any particular sequence. If you forget the sequence, that's okay. Even if you remember one exercise and you like that, and for some people, one might work good in terms of like improving salivation or feeling better, you choose that exercise and then follow it. For example, like if you like humming, you can do humming anytime during your work. So you can just walk and hum and do any chores and do the humming. That's an indirect way of extending your breathing and a very good way to improve your breathing. Right. The other exercise I want to show is that smiling breathing. So it's very easy. It also has a lot of effect on the small salivary glands all over our oral cavity. So it's just a smile and then breathe in through the mouth and then out through the nostril. It's supposed to be like providing us with good relaxation, and it can also stimulate salivation or activation of those minor salivary glands in the system. So just smile, very easy, nice inhalation. Exhale through the nostrils, complete exhalation, tucking the tummy in and slowly. Next round, the smile is for inhalation and the exhalation is through the nostrils. You'll feel that the teeth or the gum are nicely it might also make you feel a little bit more sensitive with the teeth, the cool air passing through. So just feel comfortable as you practice more and more. So watch the flow of the air all over your oral cavity. Slowly come to normal breathing and watch the breathing. Come to the complete awareness of your body. Imagine that every breath that you're taking in and then exhaling is completely flowing all over the surface of your body. Every breath that we take in is bringing us the energy, the nourishment. Extend every single inhalation and exhalation. The slower we breathe, the better it is. Three more deep breaths here. And you can open your eyes. Let me quickly recap the physical postures that we did. We started off with the eye movement, or started off with the awareness of the breath and the body first, right? So we became aware of the whole body, and then the breathing. Then we started with the eye movement exercises, up and down, sideways, diagonally, right? And then all over, right? So around in the clockwise and counterclockwise. Most of the physical exercises that we did were kind of balancing on both sides. We did on both directions. And then we did the wrist rotation. We did that. And then we did the shoulder rotation, connecting with the breathing out and then breathing in. And then we did the ankle rotation, right? So the toes making an O with the toes in both directions. And then the neck rotation, so complete rotation of the neck in both clockwise and counterclockwise. Then we did the forward bend, completely stretching up and then bending forward. And then we did the head to the knee. And then we finally did the spinal rotation, right? The leg on or the other leg, and then twisted on both directions. So whatever leg is on the top, that is the direction that we are going to bend towards. So that's the direction we are bending. And then we moved to the breathing exercises. So in the breathing exercises, what we did was that first is the awareness of the breathing, how every single inhalation is going on and exhalation is going on. And we try to slow down on the breathing by engaging the upper chest, lower ribs, and the tummy. So breathe out from top to bottom and breathe in from bottom to top, all through the nostrils. We used the same breathing pattern for alternating left to right, right to left, right? Inhale, exhale, and the other nostrils. We did the breath holding exercise. We breathe in through the left for a count of 2 and held the breath for 8 counts and breathe out on the right nostril for 4 counts, 2, 8, and 4. We did that. And then you can change the numbers, feel comfortable. And we did the smiling breath, right? So smile, breathe in, and then breathe out through the nostril. So very easy techniques. You can, so most of these techniques, right? So you can see them In 2016, Scleroderma National Patient Education Conference held in New Orleans. So I explained a lot of these breathing exercises in the video published on the YouTube channel, Scleroderma Foundation's YouTube channel. And you'll also see some of the exercises on my website, pranascience.com. You can find a lot of information, research articles, and popular magazine articles on my website. And feel free to contact me if you have any questions. And now we'll have some Q&A session if time permits. I'll be happy to take any questions.
Perfect. Thank you, Dr. Sundar. Subramanian. It seems like we have a little bit of feedback, but the participants have taken a chance to send in some questions. So I'm going to turn it over to my colleague, David Murad, Director of Chapter Relations, and he'll now navigate the Q&A section. David?
Thank you, Angel. So the first question we have is, how often would you recommend a scleroderma patient to do yoga?
Okay. So in the current study, what we did was we asked patients to try the exercises once in the morning, once in the evening. And there was some feedback that it is a little too much to do. So the 1 hour in the morning, 1 hour in the evening may not be easy for everyone. Number one, to find time, and then the ability to do the exercises or hanging on to that exercise for a long time. So what we are currently changing that to is that 30 minutes of the physical postures and 30 minutes of the exercises, the breathing exercises. You can break them into one session in the morning, one in the morning, one in the evening. So maybe breathing in the morning and the physical postures in the evening. And you can do that for a couple of days in a week, maybe at least thrice a week or 5 times a week, because these exercises are kind of gentle. So it is as long as you feel good, better, comfortable, and then if you think that it is stimulating your salivation, you can try that. Or you can choose just one breathing exercise. For example, the breath holding exercise. Do that a couple of times during the day. So traditionally, these exercises are done maybe 5 times, 5 minutes each, all throughout the day. Or sometimes we also do that 25 minutes, one sitting, just one exercise. So that is also done traditionally. So as long as you feel comfortable, if the exercise is not hurting you, you can try doing this for any length of time.
Thank you. So the next question is, how can I learn more, or how can I participate in your research?
Yeah, currently we have 30 patients that are kind of recruited. We have already recruited 19 patients in the ongoing study. We have, this is a study of 15 African Americans and 15 non-Hispanic whites. We have done so there's one slot left for the non-Hispanic white, and then there are 10 slots left for African American scleroderma patients for the rest of the study. So you can contact me by my email. So I'll forward that email. It should be on the website also, or with the organizers. Please feel free to share my email. So you can contact me by email address if you're interested in the current study. So for future studies, definitely, when we get the funding, we will be recruiting more number of patients. So we have proposed to use these exercises to study whether it is helping patients to improve or better with their symptoms in 120 patients all throughout the nation. Because now, just like this, these sessions can be delivered through telehealth means, and we can also study the biomarkers in multiple different ways. So we are kind of opening up the study to a larger national population. So future trials will be kind of, when we get the funding, we'll be able to do those those studies, definitely. Thank you for your interest. And what I found in the scleroderma community is that the interest in research participation, it's enormous. It's outstanding. Thank you so much.
Thank you. The next question, is there a best time of day to do yoga and breathing exercises?
Yes. I would say don't think too much about finding that time. If you miss that time, you cannot do it. Not like that. You can do breathing exercises any time of the day. As I mentioned, you can do some nice humming exercise anytime. The only time that I wouldn't be feeling comfortable doing the exercises just after a meal. So if your tummy is full, you may not be able to take a nice deeper breath or bend forward, things like that. That's the only time that I would be avoiding. Other than that, any time is a good time. Before a meal, try to find at least 5 minutes, 10 minutes before each meal, or before a snack. Try to find a few minutes to do these exercises.
Thank you. Next question is, are there any yoga or breathing exercises that specifically help with fatigue?
Yes, so fatigue, it is in many different diseases, it's scleroderma, cancer, and multiple other diseases. Fatigue is one of the common, symptoms. So what the exercises, the breath holding exercise that we did just now, the 2, 8, and 4, or other breath holding exercises. There are some more exercises that you inhale for 8 counts, hold it, and then exhale for 8 counts and hold it, that type of exercise. Those breath holding exercises will be very helpful in managing fatigue, and some fast breathing exercises. If your lung condition is okay, when you don't have very active symptoms, there are some fast breathing exercises that you'll be able to do that will help with the fatigue. Every time you improve the circulation, that you are bringing in more energy, renewed energy.
Excellent, Doctor. This is Kerry Connolly. We have a few more questions that are just starting to come in, a few more. One attendee has asked, she's experiencing some eye pain during the eye exercise. Is this normal?
No, it's not normal. So as I said, that anything that is painful, right? If you are starting to feel any pain, that is, that it may be a kind of a, your system is not able to accept that exercise. Maybe it is good to go a little slower or go step by step. So instead of doing like 5 rounds, try that little less extensively, right? So the intensity can be reduced, the number of times can be reduced, but I wouldn't say stop that exercise. I would say just do that exercise in a milder manner, in lower number of cycles, and then work along the way.
Excellent. One of the attendees has asked if there's a variation to the head to knee exercise.
Mm-hmm. Yes. So you can lie down on the floor, lie down on your back, and then slowly take the knee and then bring it forward. So you'll be raising your head also up at that time. So you'll be like bending, raising up, and then at the same time holding the knee, bring it forward. And you can also hug both knees and then do that exactly the same way. So just basically curl up like that. So that's one variation.
Excellent. The last question we have for you today is somebody has asked that they have a lower disc back herniation, and is there any way to avoid any of the twists, the spine twists?
Yeah, so if definitely it's best to talk with your doctor about the specific exercise if twisting will hurt it. And sometimes in low back pain conditions, this has been helpful, like the forward bend and the twist. Those exercises have been helpful. But specific to your question, so I cannot directly answer. So it may be the best thing to talk with your doctor whether this will hurt more, right? So as long as you know it is not hurting more, try that a few times with a lower intensity, less number of times, and if you feel that it gets better, try continue that. That's what my you know kind of common you know guideline, I would say.
Excellent. Thank you, doctor. That's
You're
what
very,
we have for questions for now. Thank you.
you're very welcome. Yeah, it's a great pleasure meeting with you all, and I hope you do some exercises every day and feel better. Thank you.
Thank you, Thank you, Dr. Balasubramanian. Do you have any parting words for any of the viewers or anyone out there that will catch this video in recording?
Yeah, definitely. It's been a great pleasure working with the Scleroderma community, and we greatly look forward to continuing these studies. And your participation is a great help and support. Thank you all. Stay well,
Thank you.
especially during this pandemic. Do these exercises. Stay well.
Perfect. Thank you again. In closing, I would like to thank Dr. Sundar Balasubramanian for sharing your time and expertise with us today. And I'd also like to thank our attendees who logged in and dialed in today. And a special thanks to our Diamond National sponsors, Actelion Pharmaceutical US, Boehringer Ingelheim, and our corporate sponsor, Corvus Pharmaceutical. As a reminder, these webinars will be taking place each Wednesday, and please stay tuned for next week. We will be hosting a seminar on taking the mystery out of hospice and palliative care, presented by Mary Crow. Thank you very much, and have a wonderful day.